Hi everyone! Today we are going to be talking about juvenile rheumatoid arthritis, also known as juvenile idiopathic arthritis. So what is juvenile rheumatoid arthritis and what is juvenile idiopathic arthritis? Actually, both of these terms mean the same thing. They are interchangeable. Juvenile rheumatoid arthritis is mostly used in the US, and juvenile idiopathic arthritis is more commonly used by specialists. What does idiopathic mean? It means that the cause isn't known. Around 300,000 children are diagnosed with arthritis in the US. It is an autoimmune disease as well. And in order for it to be considered chronic, this type of arthritis has to be persistent for more than 6 weeks in a child that is 16 years or younger. At this time, there is no way to prevent arthritis in children. So there are 5 different types of JRA. First of all, there is pauciarticular, otherwise known as oligoarticular, polyarticular, systemic onset, enthesitis, and psoriatic JRA. The first that we are going to be looking at is pauciarticular. Here we see that it affects 4 or fewer joints, and it is usually the larger joints that are affected. Girls under 8 are most likely to develop this type of arthritis. It also has the potential to follow children into adulthood. It is the most common form of JRA, and about 50% of children with JRA have this form of arthritis. Regular eye exams are extremely important with anybody that has JRA, but especially with pauciarticular, because eye disease does affect between 20 and 30% of children with this type of JRA, so make sure to get those eyes checked. Then we have polyarticular. It affects 5 or more joints. The joints affected are mainly small joints, but of course the larger joints may be affected as well. It can begin at any age, and it is also symmetrical, which means that the joints in both sides of the body are affected. There is an antibody called the rheumatoid factor that increases the severity of this type of arthritis in children. So this is also a factor that makes children carry arthritis with them into their adulthood. Then we have systemic onset. 1 or more joints are affected here. It is the least common type of JRA, and it actually begins with spiked fevers of 103 degrees and skin rashes that are quite noticeable on the child's skin. It affects between 10 and 20% of children with JRA. There's also joint swelling, and damage may not appear for months or even years once those fevers begin, but a lot of the damage is irreversible once it is discovered. Anemia and elevated white blood cells are also indicators of systemic onset arthritis. And it affects 1 in 10 to about 1 in 7 children with JRA. Then we have enthesitis. It is the swelling of the tissue where bone meets a tendon or ligament. Between 10 and 50% of children are affected by enthesitis with JRA. It is also known as spondyloarthritis, so that is another name for enthesitis. Children may have joint pain without obvious swelling, and they may complain of back pain and stiffness, and it does affect the spine, the hips, the knees, ankles, and feet. The amount of time that enthesitis lasts just simply depends on the patient and what they are experiencing themselves. But it usually starts in late childhood or even into adolescent years. Lastly, we have psoriatic. Psoriasis is normally developed first, and later psoriatic arthritis is diagnosed. Normally, you'll notice that the skin is red and it may look like a rash as well. Other symptoms may be inflammation of a finger or a toe. There may be pits or ridges in the fingernails, and normally you will find a family member that already has psoriasis, whether it be a parent or even a sibling. There are more than 200,000 cases in the U.S. of patients with psoriatic JRA. So lastly, it is more common in adults, but a child can develop it if they do have JRA. So how is JRA diagnosed? Diagnosis mainly depends on physical findings, medical history, and the exclusion of other diagnosis. So it can be difficult to diagnose because there is no single test to confirm the disease. There are a number of blood tests that can be done to outrule other diseases that will help point towards arthritis. And once that is diagnosed, bone tests can be done to see the amount of damage that the arthritis has caused to the joints. So what causes JRA? JRA is caused by the immune system attacking its own healthy cells and tissue. It is not known exactly what causes the immune system to malfunction in JRA, but we do see that it targets the lining of the joint known as the synovial membrane, which causes inflammation, and when inflammation is left untreated, joint damage may occur, which can be irreversible. In rare cases, such as psoriatic or enthesitis arthritis, a parent has the same form of arthritis already. Because the causes of JRA are unknown, no one knows how to prevent it as of yet. So what are some of the symptoms of JRA? We see limping, we see stiffness once a child is woken up from sleeping, from a nap. We see the reluctance to use an arm or a leg. We see a reduced level of activity, persistent fever, joint swelling, and the disability to use fine motor skills. A child may not complain about joint pain, but limping may be something that is noticeable. They may be a bit more clumsy, bumping into different things. There can also be high fever, swollen lymph nodes, or even rashes, as we spoke about them earlier. My close friend Clara experienced many of the same symptoms. She was diagnosed with JRA at 12 months old. She was unable to start walking until the age of 2.5 years old, and even then she had to use a walker to help her to continue to learn to walk. She even had to use a special gripper on her pencils because she was unable to hold onto those. So she definitely experienced some of the different symptoms that we see listed here. So what is the treatment for JRA? The goal of treatment is to reduce pain and stiffness and mainly try to keep a child's life as normal as possible. Treatment also depends on the child's symptoms, age, or even general health. So a combination of medications, physical therapy, and occupational therapy are the best way to treat JRA. Physical therapy will help improve and maintain muscle and joint function, while occupational therapy will help improve with the ability to do daily activities. A type of therapy that is available is aquatic therapy, which is what my friend did to help her learn to build up those leg muscles and learn to walk, and that's where she took those first steps in the water. So the best way to come up with a plan for a child with JRA is to work with a pediatric rheumatologist who specializes in children with arthritis. So let's look at some of those medications that a child would need to take with JRA. First of all, we have non-steroidal anti-inflammatory drugs, or NSAIDs. That includes ibuprofen and other prescription drugs that are often given to children to help reduce joint pain and inflammation. Then we have DMARDs. These are given if NSAIDs aren't working as well. They are taken along with the NSAIDs. A common one is methotrexate, and it is to ease inflammation and help JRA from becoming more severe. Then we have corticosteroids, such as prednisone is an example. They are given to children with severe JRA. They can go directly into the vein, into the joint, or taken by mouth. Steroids are known to increase weight gain and give off a rounder face. There is likely a greater risk of infection and weakening of the bones. Lastly, we have biologic drugs. These are genetically engineered, and they are given when everything else is not working for a child. They do suppress the overactive immune system, and I should have said this before, but most of these medications are immunosuppressants, so it is likely that a child will become sick more easily than a normal child would, just because their defenses are down and their immune system is not working like it should. So we spoke about physical therapy and occupational therapy. Those are very important as well. And then we also see that eye exams are also extremely important, and we'll talk about that in the next slide. So what are some extremities of JRA? There's a potential of eye inflammation in a severe case of JRA, and simply because the fluid surrounding the joints is similar to that of in the eye. So eye diseases such as arthritis and uveitis may develop, and even glaucoma, cataracts, and in extreme cases, blindness may occur as well if eye diseases are left untreated. So some more extremities are that growth in affected joints may be too fast or too slow. This may sometimes cause one leg or arm to be longer than the other. And we also see that bones may begin to thin, which could cause osteoporosis. And in rare, actually less than half of cases, the internal organs like the kidneys, the heart, the lungs, and even the endocrine system may be affected. So life with JRA, what's it like? Children with JRA can lead extremely normal lives with the proper care and proper treatment. Parents should be familiar with Federal Act 504 because it may make them eligible for some special assistance at school, even with different state agencies for services such as rehabilitation and different therapies. While some children outgrow JRA, there are a number of patients that do not outgrow it, and we see that in females it can have an effect on their ability to become pregnant, and that's mainly due to the different medications that they are on. So that is another thing to consider and be mindful of. And lastly, studies estimate that by adulthood, JRA symptoms disappear in more than half of affected children. So with the proper health care, with the proper treatment, a child with JRA can lead a very normal life and can also lead a very normal adulthood as well. Well guys, thank you for joining me, and I hope that you learned something today.